Namaste. Myself, Dr. Hitendra K Garg, working as a senior consultant in gastroenterology and hepatology in Apollo Hospitals. Today, we'll talk about the ulcerative colitis. Ulcerative colitis is a chronic inflammatory bowel disease in which the inflammation settles in intestinal mucosa of large bowel. Ulcerative colitis is a chronic inflammatory bowel disease in which the inflammation settles in the superficial layer of gut, especially the large bowel. We will discuss about how to prevent this disease, what are the lifestyle changes required apart from the drugs, what are the dietary changes required, what are the drugs which one should avoid, what are the how we prevent the inflammation or how we prevent the exacerbation of ulcerative colitis. What are the lifestyle changes required? In patients of ulcerative colitis, one should keep himself hydrated, one should take enough water, one should take the low fiber diet, one should not take the high fiber diet which may cause a constipation, which may cause a pain abdomen, which may cause a trouble to the patient. So, low fiber diet, and one should keep himself or herself hydrated. How soon one can recover? It depends on the initial presentation. Though most of the patient doesn't require admission, however, even though those who require admission, mostly they discharge 5 to 7 days after initial admission. Any trends in patients of Indian population related to dietary trends? If we look at the patients of ulcerative colitis, we look at the patients, those who are living in Western world, living in Indian world, there are difference in the dietary contents. They are more of a junk food, they are more of taking the carbonated drinks. In Indian population, less often they take a carbonated drink as compared to the Western population. So, carbonated drink, junk food, they definitely increases the gut irritability and increases the exacerbation of the ulcerative colitis. Can it be resulted from a medicines taking from the other diseases? Ulcerative colitis usually is a chronic idiopathic autoimmune disorder where it is happening autoimmune or the genetic reasons. However, there are certain diseases like if a patient is taking anti-cancer drug which can cause the drug-induced colitis. So, anti-cancer drug increases the exacerbation of the ulcerative colitis. Patients, those who are taking the painkillers, especially patients those who are having the pain in the knee, pain in the joints, they take NSAIDs, they increases the exacerbation of the ulcerative colitis. Patients, those who are taking the antibiotics, they also have increase in the prevalence of exacerbation of ulcerative colitis. Can I have cola, curd, juices and pickle? If we talk about the cola, if we talk about the juices, if we talk about the pickles, these all three one should avoid in patients of the ulcerative colitis because these all are increases the gut irritability. So, there are chances of increases in the exacerbation of the ulcerative colitis. So, as far as the curd is concerned, because curd contains lot of probiotics, so it is beneficial in patients of ulcerative colitis rather is harmful. Which fruit, vegetable, meat can I have? If we talk about the fruits, all kind of a fruit is permissible or beneficial because all contains antioxidants, carotenoids. So, these all kinds of fruits are permissible. So, as far as the non-veg is concerned, the high protein like chicken or fish is beneficial in patients of ulcerative colitis provided they should not be fried, they should be grilled. And if we talk about the red meat or the mutton, one should avoid in these non-veg in patients of ulcerative colitis. And we talk about the vegetables. Vegetables, all kinds of leafy vegetables, green vegetables are beneficial because all it contains antioxidants, lot of vitamins, lot of minerals. So, all these are beneficial in patients of ulcerative colitis. Can I consume alcohol, beer, whiskey and wine? In patients of ulcerative colitis, all the hard drinks or the aerated drinks one should avoid because it increases the gut irritability. which can lead to the exacerbation of ulcerative colitis. So, all these drinks should be avoided. How much exercise one can do? It is exercise in patients of ulcerative colitis is beneficial. Though there is no recommendation how much one can do the exercise as per their limit. How much fluid to drink? In patients of ulcerative colitis, keep himself or herself hydrated. One should not be dehydrated. So, fluid limitation is not implicated in patients of ulcerative colitis. One can take as much as water as he wants. Warning signs to look for, especially for the family member. In patients of ulcerative colitis, what symptoms the family look for, whether they develop a ulcerative colitis symptoms or not. Because it's a genetic condition, it's an autoimmune condition, so family members are prone to develop a ulcerative colitis. So, the symptoms, the most important symptoms, one should look at the weight loss, one should look at the diarrhea, one should look at the bloody diarrhea, one should look at the pain abdomen. What are the do and don'ts in patients of ulcerative colitis? The few things one should avoid. First is if a patient is having a pains, one should not take NSAIDs, non-steroidal anti-inflammatory drug. One can take the tramadol, one can take the paracetamol. One should not take the non-steroidal anti-inflammatory drug. The other is the important one should not take the over-the-counter antibiotics, because all these drugs increases the gut irritability. One should avoid the alcohol, one should avoid the carbonated drinks, one should avoid the fried food, one should avoid the junk foods. So, these are the things one should avoid. What are the do's for patients of ulcerative colitis? One should take the low fiber diet, keep herself hydrated. One should take the enough amount of protein. One should do some stress management like yoga or the meditation. Today we have talked about the ulcerative colitis. What is the ulcerative colitis? And how do we prevent apart from the drug which is being prescribed by the physicians? Stay safe, stay healthy, stay informed. In case your near or dear ones develop a patient's symptoms of ulcerative colitis, please visit your nearby physicians or gastroenterologist. Namaste.